Hi everybody, and as we said, we are going to get on to the challenges, but both Emma and I are here to talk to you about how we implemented the system of using wipes into Southampton Hospital. We're a really large hospital. We've got 1,400 acute beds. We're a regional centre for many different specialties. And originally, when I heard about waterless bathing, it was from a lecture given by Lisette Schoenhoven, who was president of the EPUAP at the time. And she's done a lot of research at rolling out this wipes-based system in nursing homes in the Netherlands. Now, to be honest, when I heard about it, I was very much of the point of view, no, I don't like that idea. Before Tissue Viability, I was an elderly care nurse and sister and worked in elderly care for over 15 years. And if you weren't going to that bed soaking wet and soaking, you were not going to help your patient. So it had to be a lot of convincing for me as well. But what we found, we had a few issues in the hospital. So the first issue that we had with washing with the water, that infection control came forward and they found some issues with bacteria in the sinks in the bays. So we weren't allowed any longer to throw water following a wash down the sinks in the bays, which made it very difficult for the nurses. They were having to open up the bay doors, carry bowls of water from the sluice down to the room, wash the patient, take it all the way back. They weren't able to really change the water in between when they were doing the wash, and there were lots of issues there. We also had issues with our towels laundered and sent into the hospital, and they are quite rough. So we were seeing a lot of patients weren't happy with the towels either. And quite often what was happening is that the hands and face wipes that were being used around the place for up before meal times were being used to clean patients. So we decided to see what the wipes were going to be like. So we did a very, very quick time and motion study. So the tissue viability team took a bay of 6 patients up on one of the elderly care medicine for older people wards. And we went in, we washed all of the patients with soap and water one morning, and the next morning we used the bed bath wipes. And what we found was that we saved over 40 minutes using the wipes, and we're using the water. On 6 patient washes, we saved over 40 minutes. So firstly, that was great from a nursing point of view and for a time-saving point of view. The second thing is the patients the second day when we were using the wipes were literally saying, oh, this is so much nicer, they're so soft, lovely not to have to be scrubbed with wet, cold water. So we started to get a feel that this might be a good way of moving forward. We then, as a trust, went about finding the right wipes, and that was a bit of more of a challenge. Infection prevention wanted us to ensure that we had a wipe. If we were changing a system, we had to have a wipe that contained chlorhexidine at the right percentage to enable us to continue with our MRSA decontamination process. So we looked around and we found that the set of wipes made by GAMA Health had both the bed bath wipes, the chlorhexidine wipes, which are used for bed bathing as well. And also an added bonus is we took on the Contiplan wipes, which are for incontinence. And we'll talk a little bit about them a bit later. So what did we do next? We had to then approach lots of staff who didn't like the wipes and didn't like the idea. And we had a lot of words bandied around like festival wash and that's never going to clean the patient, and that's not a proper wash. So I'll just hand over and I'll let Emma explain her opinions at the time as well.
Hi, so yeah, as Fran said, it was a big change in culture for all of us, and I was of the opinion, as a lot of people were, how can you possibly wash a patient without hot soapy water and towels, and how we've done it for years and years. So really, Fran was really helpful, and I know with lots of us that were quite anti the approach, we had trial packs of the wipes. We tried them out on each other. So I got my nurses to try them out on themselves. We did, and realised actually you felt clean after them. So went ahead with Fran's support and started to implement them. Some nurses felt that they might be seen as lazy, not washing the patients properly, but we never had any of that feedback from patients. And, you know, for me as a ward leader, it was really important to get on board with such a big change in culture and try and understand and believe in it so that I could implement it for the rest of my team. The wipes themselves are really soft and I think kinder to patients' skin. So the soaps that we had in the trust at the times were the very small, non-soap really. They didn't foam up. You never felt that you were getting anything done properly. Water would go lukewarm, and as Fran said, you couldn't change the water because we were having to carry water from the bedside down to the sluice, which takes time. Also, there's the spillage aspect, so you know, frequently splashes of water on the floor causing slips. So it took away all of that for us. And I know Fran touched on the scratchy towels. I think lots of nurses know that drying patients with those scratchy towels was never very kind. So it took that away as well. And we were already using the waterless shower caps and had done for a long time. So in my mind, I started to think, well, what's the difference? Well, we've already got one system in place and that was working quite successfully. And the chlorhexidine wipes, I think, were a game changer in making sure that patients actually got their chlorhexidine washes in the right way. So for a lot of patients and a lot of nurses, they'd squirt the chlorhexidine into the bowl of water, which we know isn't the right way to do it. So actually using the wipes meant the patients got the right treatment and the right prevention of MRSA. I don't know whether Fran's got anything more to add.
No, I think I'd forgotten about chlorhexidine actually and the hippie scrub. So I think we found we hadn't, I don't think our infection prevention team had realised that the decontamination was basically being done with the hippie scrub into the water rather than the hippie scrub applied directly to the skin and then left for, I think it was 2 minutes and then washed off. And I don't think that was happening. So actually introducing the wipes made a difference to that, didn't it, Emma?
Most definitely. And, you know, from just seeing it happen on the wards, we could see that there was more compliance with nurses providing the chlorhexidine washes in the right way. So we've talked about how, I said how much kinder it was to the skin. So patients that maybe had sore skin, not using the drying soap and water, patients would comment on how much nicer it felt being washed with the wipes. And then moving on to also the Contiplan wipes that were introduced at the same time, which we used for patients who were frequently incontinent or had some evidence of moisture damage to clean their skin. They, again, patients didn't complain of pain. So when you add soap, you know, water even to damaged skin, it can cause pain, but actually the wipes were much kinder. And we saw it less since using them, less instances of moisture damage. That's just me seeing what I've been seeing on the wards. I've got no proper evidence to back that up, but what I've seen is less evidence of moisture damage because it leaves the film of barrier on the skin.
And then we obviously, as Emma said about the Contiplan wipes. Now the Contiplan wipes are a wipe that cleanse, but they also contain a barrier product within the wipe. So you're doing two things at once. And it was really, really useful for us to see that the patients that had really painful moisture damage, and a lot of the time when the skin is really damaged, we get an awful lot of excoriation to the whole buttock area and to the groin. And these wipes, they're so soft. You can't tell how soft they are until you've actually used them, but they are so soft, and they leave that barrier product. So for us, we were able to implement a whole new moisture damage care pathway. So we didn't any longer have to use a secondary cream as well as having to wash and dry the patient. So with the wipes, you can air dry. So you allow the wipes to dry themselves. You don't have to dry the patient with a towel to clean them. And the one thing that we have noticed, and Emma alluded to it, and I don't know, Emma, if you agree with this or you've found this, is what we had been finding was a lot of splits at the top of the buttocks for our patients, a little bit of damage just at the top of the area around the natal cleft. And a lot of the time the patients would say, or it's ever so sore when they're cleaning me and they're wiping me with a towel. And I think that the wipes have prevented that. We're not seeing that as much anymore. Do you agree, Emma?
I would definitely agree with that, because I think the roughness of the towels and would just maybe scrape the skin, or just using the dry wipes. So the Contiplan wipes are just so soft. We've all had a go of putting them on our skin, and they really are incredibly soft and just leave a very fine film of sort of moisturiser, which then negates the need for adding extra emollients, which we found that quite often nurses would just really lather it on and leave thick layers on. So, and the patients would always say, oh, this is so much more comfortable, and you'd hear those less sort of wincy pain from the patients to when you would use soap and water, or even just water on their moisture damage.
Absolutely. And I think that's been a huge thing. And I don't think, to be honest, we had an awful lot of a challenge about the Contiplan wipes. I think the challenge was more when they were thinking that about the bed bath wipes. I think that's one of the challenges that we really faced. The Contiplan wipes were a much easier product to sell. As soon as people felt the Contiplan wipes and used them once with a patient, then they immediately started thinking that it was a much better process and a much better thing, a product for the patient's skin. So I think with the bed bath wipes, I think that was more of an issue to for us to continue and to get past. And it just took time and patience and letting people try it themselves. I think that was one of the biggest things. If you let people try it themselves, and you're not sort of saying this is what you have to do, but explaining it and working with them to see what the product is like, then you will, then we haven't really got any staff that have said that they don't want to use it. I haven't met anybody. And normally people are very quick to say if they don't like it.
We sort of touched on COVID and nursing in isolation. We all know that, you get everything together for a wash, but more times out of none that we always forget something. But actually, when you're donned up to go into either a room or a bay of patients all in isolation, to just have the wipes, to take them on in, and you've just got that one item rather than thinking about towels, soap, water, changing bowls of water. You're in the bay with your patients and able to just provide that care in a timely way, and without running backwards and forwards or having runners outside the room to try and collect your things. One of the things, so we've got the warmers where we keep the wipes warm on the wards, but obviously you take them out and they do cool down, and that was something that we worried about, cleaning people with what you might see as cold wipes, but actually they would either be warm or room temperature. But water in the bowls would, by the time you'd get to actually wash the patient, once you filled the bowl up, you set everything up, the water had gone tepid warm anyway. So it seems, you're not washing with cold water at the end of the day. And it just seemed to be a success after all of our thoughts that this isn't going to work. We need hot soapy water for patients. It's not going to work. Actually, it's been a great success, and people moved over to it very, very quickly. Nurses, once they realised in the first couple of weeks of using it, how much easier it was for nursing time and patient care, it seemed to be improved because of it. It seems to have worked really, really well.
I think Emma's put that in a nutshell. So from a really group of staff, especially our senior staff, when I took it first to one of the senior meetings and we were talking to some of the divisional heads of nursing within the trust, I got a very, very negative response. And even though I was negative myself, I was finding myself justifying why we should trial it. And it took a lot to get us to agree to a trial. And a lot of that was the free sample packs that we gave out to staff. And we just said to people, do you know what, let's not say it's awful until you've taken it home and you've tried it yourself. So we all took packs home, we all used them, we all washed with them and didn't shower for a day and to see what it felt like. And actually it was quite amazing. It was you did feel clean and you did feel fresh, and it was really nice. So I think that was quite a challenge to face all of that, but with a lot of education and a lot of explaining and a lot of actually discussing with the staff, who do they think is going to benefit? So a lot of staff were very much, oh, I have to get the bed wet, I have to make it really wet, and as I did as well, to be fair. However, is that me wanting to feel like I've given a really good wash, or is that the patient getting the best experience out of it? So when we were talking to the patients were saying to us, no, much prefer the wipes. Can I have the wipes, please? I don't want soap and water. So a lot of staff that were very against or a little negative towards the rollout, we were saying to them, just ask the patient what they prefer. Give them the opportunity to wash with the wipes. And if they don't like it, take in the soap and water. And I think that was, as Emma said, it was a good way to get the staff to think about what they were doing, and actually for them to take some ownership and learn along the way, taking feedback from the patients. So you've heard that we rolled it out in the trust, and to be honest, it's an extremely embedded system. We've got the staff love it. In fact, we had a little bit of a supply issue recently, only because the orders had gone, something had happened with the orders, and the number of phone calls my team got saying, oh my God, we need these wipes, we need them now. So they're actually really, really embedded, and the staff rely on them a lot. So some of the challenges we faced to rolling this out, we thought that the challenge that we were going to face and have to overcome was the people being against using wipes. But actually it went a little bit further than that. So we had a lot of issues with the warmers. So the warmers have been supplied by the company. They're absolutely great. They sit on the wards. They keep those bed bath wipes warm. They work really well. They're not very big. They're like a little microwave, and the wipes have little sections to sit in. They're great. But I hadn't realised that we had to worry about having a mains overload, because that's a lot of more electrical appliances being used. So we had to go through our engineering department for that. We also had unexpected issues with people feeling very strongly about the environmental impact of using wipes. And I know that there are lots of things out there about baby wipes and how they're affecting the environment. And we hadn't really planned for this. We had thought about the fact that we were actually going to use less. So when you looked at using all the dry wipes that we've been using to wet and wash the patient with, actually the size of the pack of wipes and the pack of dry wipes and the dry wipes that we used was less waste. So we'd thought of that, but we hadn't actually had that next step in thinking about the environmental factors. And actually we had a very strong negative response from a lot of people. I got very accused of wanting to kill turtles and ruin the environment and the world for their grandchildren, and etc. And it was really interesting to hear that and to face that. And I think the company hadn't faced that before either. So I think there was a lot of working together to try to find out what was going on. And from my perspective, it was great because I actually found out that we are a neutral waste trust. So all of our waste, including our clinical waste and our general waste, goes to a facility and is burnt to make fuel. So we don't put anything to landfill at all. So the trust is completely environmentally neutral, which I had no idea of, but at least that helped people to stop those fears of us going a bit too far with the environment. Some of the other things that we were looking at was the fact that we were sending towels off to be laundered. We were sending a lot more sheets. We're finding when we were talking about washing the bed and making sure the bed was really wet, quite often you would have to change the sheets 2 or 3 times while you were doing that. So again, that's that's quite an environmental factor when you're going through lots of sets of sheets. And the other thing I think that we noticed from a tissue viability point of view is that a lot of our patients are wearing TED stockings or anti-embolic stockings, sorry. And often the legs weren't being washed, or people were washing what they thought they would wash and they weren't washing the whole patient. And the beauty of these packs of bed bath wipes is they actually tell you there's a wipe to do this and a wipe to do that bit and a wipe to do the other. And there's enough wipes to manage the whole body. And so it was really nice that the staff started using the wipes for that particular purpose. So we were getting a really good getting good usage from the staff, and also the patients were just really happy. And the wipes contain lots of moisturizers, etc. So they were just keeping the patient's skin much better and leaving it feeling better than the old soap did. And applying emollients afterwards wasn't always as necessary. So we weren't finding patients with as dry a skin. So that's the bed bath side of it. I don't know if you've come across anyone on your ward areas.
I've not heard any nurses say they don't want to use them anymore, or never wanted to use them once we tried them out and put them into place. And equally, I don't think I've ever had any negative patient feedback. Would you agree, Fran? I've not.
I think the only negative feedback I've had is about the fact that they can't get them when they go home, always. I think that is one of the issues for us, is that we do use them routinely now on every patient that comes into hospital. And of course, when I say that, if a patient particularly wants to, these are, I didn't make that clear earlier, these wipes are being used for patients that need to have a bed bath. So if a patient can get up and go and have a shower or go and wash themselves in the bathroom, then obviously we don't say to them, well, you can't do that, you have to use a wipe. These are for the patients that are bedbound and that need assistance with their personal hygiene. However, saying that, quite often if the patients can wash themselves and they're not having a shower, they ask for the bed bath wipes, because a lot of them have used them at an early stage in their stay, when they were a little bit more incapacitated, and then as they get better and they are able to get up and move around, they then still want to use the wipes. So quite often you will find them asking the nurses to grab them one out of the warmer when they go to the bathroom to have a wash. But they're used mainly for the patients that are bedbound. But we've really not had any comeback. It was that initial, I think it's that initial thought, you're going to use a wipe and that's going to wash a patient. And we're both completely there with people. So I know there'll be people out there now thinking, oh my God, this is going to be, that's ridiculous. You have to use soap and water. And that's exactly how we were. I can honestly tell you that we were saying, nah, this can't be right. Not every day as well. That's the other thing we came across, Emma, wasn't it? Is it's all right to use wipes just once or twice, but you can't use them every day.
Yeah, definitely. People would think that, but you couldn't see them every day. So it was, you know, it took a lot of believing as a leader to bring your team along with you and to get them on board. And I think that's the key. You know, Fran came on board with it, had to lead with our seniors and then down to ward level and at the bedside. So really was a lot of leadership and getting people to understand and believe.
So I think, you know, talking about the soap and water, you know, a lot of soap is very acidic. Its pH is not great, and so it's very drying for the skin. And I think sometimes we don't realize that. We think that soap and water is the best thing for the skin, but a lot of people don't use soap anymore. There's a lot of people that wouldn't use soap on their face, for example. But then if you're in hospital and you're being washed with soap, then you would be washed with soap on your face, but they don't like that, you know. So I think it was a whole change of culture. We had to give staff time to accept, time to think about it and come up with what they thought would not be workable, and then try to answer those questions. I think the rollout took a while. I mean, when we're talking about this now, I did that first time emotion study in 2015. And it took me 4 years of discussing with different people, with trying to find the right products, with overcoming each of the barriers that we have already discussed about electrical appliances for the warming, the right wipes, and the cost, because it was very difficult. It's very difficult financially in any trust or in any organisation at the moment to bring in any change unless you're going to see a cost improvement or a cost reduction. And that was a big barrier that we also overcame, is trying to show that actually this is a cost reduction. And I think with all the workings for the cost of the bowls, disposable bowls, the dry wipes, the bars of soap, and then trying to put something together about the fact that the nursing time as well, we actually showed that it was cost neutral with a very slight cost saving, and that was a big push for us, and it meant that we could start taking this project forward and start taking it to the next level. But as I say, that did take us a good 3 or 4 years before we got to the point of actually thinking about rolling it out within the trust. We're all living through this very strange time of COVID, and for us in the hospital, it's been in this hospital, we've had, you know, a rough time, as everybody has had. But I think, and Emma has already alluded to it, but I'm sure again, I think that one of the biggest things during COVID was the wipes were amazing. Not having to waste that nursing time, and also the PPE. So when you're struggling to manage the amount of PPE you have, and we've all had PPE shortages, you know, there wasn't enough in the world for everybody because we all needed it all together. And I think when we were struggling with that nationally, not having to go in and out of a bay and take everything off, and if you've forgotten something, to have to strip it all off and to go out, and then the disposal of the water, you can't dispose it in the sink because we don't want, you know, obviously with COVID patients and other patients, we don't want that risk of infection, and we'd found that was a problem in the sinks. So I think that during COVID, I think they've earned their weight in gold, really. I think they have been amazing. Emma, do you have anything else on that? I think they've just been great on the wards.
I think I'd agree with everything you said, Fran. I mean, just that not having to don and doff all that heavy PPE just to go and get 1 or 2 things, when you can just take your wipes in and you've got everything you need to wash that patient, just saved so much time, and for nurses, and actually meant the patients just got your time there and then, rather than dotting in and out and stripping your PPE off.
Absolutely. And also, you know, with COVID, we've also found that their patients are getting a lot of skin damage, and also their skin is much more vulnerable to certain things and drying. So a lot of them have had to have very high flow oxygen and you know, more medical devices, etc. So the wipes have been really beneficial with that as well. So they've helped us to ensure that we can manage their skin quickly and easily. And you know, there have been a lot of patients with loose stool. And I think that's been a thing with COVID. We've had a lot of patients with very loose stools and diarrhea, and having those Contiplan wipes have just been brilliant, because you don't have to worry about running out of the room to go and grab water, etc. You've got wipes. We can keep wipes outside the room. They're right there for people, and they're just so on the space. And the fact that they're providing a barrier at the same time, you know, you're doing good, even if you're trying to do it more and more frequently. You know, you're giving that barrier without having to have other products there as well. And supply of products have been difficult during the time. So knowing that we've got the wipes available to all areas has been great, and it's worked really well for all of us, especially in our intensive care unit. Have used them widely throughout, you know, especially with prone patients as well. Trying to clean prone patients is quite a challenge, but actually when you're deproning or you're doing a change of position, it's really been easy to quickly give them a wash over with the wipes, rather than having to get them with the water and then to dry them. So that's made a massive difference in intensive care and in the prone patients, because obviously a lot of those patients had pyrexia and were very hot and sweaty. So you know, having to be able to give really good care in really stressful situations with very limited time and limited staff, the wipes have helped. Without a shadow of a doubt, they've helped us maintain really good skin care for our patients. And we've had very little damage to skin on patients in intensive care, and that has been, you know, that's amazing for us. We can contribute a lot of that to the fact of the system that we're currently using with the wipes. So one particular patient is a lady that's been in with us who's in her late 30s, who's had vulval cancer, and there's a lot of moisture and discharging in that area, and she actually was in an extreme pain. They were putting a lignocaine gel on to the area, and that was hurting her. She was on very strong painkillers. We were trying lots of different things to try, and topical morphine as well. The doctors had tried, because she was in so much pain. I went to see her, and we took her a pack of the Contiplan wipes when we were rolling them out, and she cried. She literally cried and said, I want to tell everybody about these things, because this is just changing my life. She was able to cleanse herself again. She didn't have to keep relying on other people coming with different products. So it really made a massive difference to her. And you'll all have, you know, seen patients that are in so much pain with their damage, especially in the perineum and the perianal area. It's just excruciating. So that's been really great. And again, it's not having to dry; it's letting it air dry. And then the second one, which is a bit of an unusual one, because these wipes are for adult patients. So we've rolled them out for adults because they're not licensed for use on pediatrics, because it's so difficult to do the studies and get that approval and that for little ones. But we are using them on pediatrics in certain circumstances. And what we do as a trust is we speak to the parents and we explain that they're off license, they're not licensed for the children. And if they're in full agreement, then we will give them to trial, we'll monitor, and if there are any skin reactions, we would obviously stop, but we haven't had any skin reactions. And at the moment, we've got a young girl who's got leukemia and is having chemotherapy, and she's 12, and going through that very difficult age of a 12-year-old girl, and she's got an awful lot of moisture damage in her groins and around her genital area and around her bottom, and she's so embarrassed, doesn't want anybody to see it, doesn't want it touched, and is having loose stools quite frequently. So I went up and spoke to her mum and said, would you like to try these? And she was very happy to. So she tried them, and she called down and asked me if I'd go up. And I went up to see her, and she just was crying and said, this is just the best thing ever. And funnily enough, she's a carer who works in a residential home, and she's already phoned the residential home manager and told her they've got to buy these because they are going to be amazing for their residents. So I think for her as well, it would have been great for you to hear it from her mouth and not from mine. But you know, she really has found the difference because of it's really nice because they're quick. You can maintain that privacy and dignity for the patient at the same time, and that's really important. And although, you know, for children you would have to think about very young children, we've used it on a 6-year-old, a few 10-year-olds, and sort of in that age, no younger than 6, but you know, it has worked amazingly. And as long as you're giving all of the information to the parents and you are ensuring that they're making an informed choice, then we have moved forward with that. So it's been absolutely brilliant, the whole rollout. And again, the challenges for pediatrics is they want the wipes and we can't give it to them. So that's our next battle to challenge, and maybe putting a process in place to ensure that staff can use them without having to come through my team first, so that we don't have to go and see the patients. They can just give them to certain age groups. So that's something that we need to work on in the future. But at the moment, as both Emma and I have been saying, the feedback from patients has been brilliant. They absolutely love them. We haven't had any negative feedback. The only negative we had at the beginning was the staff, and now we don't really get negative feedback from them. Now it's out there and it's being used all the time.